Welcome to The Hypnotist, the show that gives you inside access to cutting-edge hypnosis with real clients facing genuine issues. Brought to you by the hypnotherapist demanded by celebrities, CEOs, and even royalty, Adam Cox. These recordings took place live from Adam's clinic in London's world-famous Harley Street. This podcast features powerful hypnosis, so do not listen while driving or operating machinery. This recording is not suitable for those with epilepsy or severe mental health issues. So, get yourself comfortable and enjoy today's episode of The Hypnotist.
Hi, it's Adam here, and on today's episode of The Hypnotist, we have a guest hypnotist, and I'm very fortunate to be joined by Seth-Deborah Roth. Welcome to the show.
Hello, hello.
Great to have you here. First of all, let's get to know you a bit. Tell us a bit about yourself and how you got into this fascinating world we call hypnotherapy.
Well, first of all, I'm a nurse anesthetist, and when I was in anesthesia training, my instructor did hypnosis, but she didn't call it hypnosis. She was from Russia, an anesthesiologist from Russia. And she had also trained in China. And anyway, this is at a big county hospital, Brooklyn, New York. And our patient had lifted up a garbage container. The mafia was not happy with him. And when he lifted off the top, it burnt his face. And we were doing a skin graft from his legs to his face. This is back in 1973, 74, and they were using gases mainly at that time. And because of his burned face, we really could not put the mask on the face. And so you have all the normal air coming in besides the nitrous and the halothane, and he wasn't going to sleep. And Dr. Blumenfeld started talking in his ear. And suddenly he just went head tilted, tongue out, and he went to La La Land. And we did the skin graft. But I didn't know it was hypnosis. It was just Dr. Blumenfeld's way, right? And I modeled her and combined that with my own personality. And fast forward 1987, I'm facing spine fusion. And the doctor told me he was going to go through my abdomen and scared me, right? I've always worked in the OR, so normally surgeries don't scare me, but then it scared me. And I started at home putting my hand on my hip and doing visualizations, and the energy that I'd been holding in my body started to spasm out, and you could see my hip rising and falling from the increased circulation. And I called my husband over, who was a surgeon. I said, Ken, look at this. And my hip's going up and down. And that was 1987. And I never had the surgery. And I'm so grateful that I never had the surgery, because now I work a lot in pain management with people who've had like 5 back surgeries. We call them failed back surgery syndrome. And I'm very grateful. That's how I got into it.
You were on the front line seeing, and what's interesting to hear about that is a lot of the time hypnotherapy is put into this category of complementary therapy or alternative therapy. And obviously in surgeries and hospitals, it's kind of seen as kind of proper, quote unquote, medical kind of treatment. And it's always seemed confusing to me because this Venn diagram doesn't have to be separate. They can overlap. And it seems like you saw that actually hypnosis was used even if it wasn't called hypnosis, but hypnosis was used there. And that kind of planted a seed of an idea of actually it can really help people in situations that it's not normally used. How did that change your trajectory after that point, from the 80s onwards?
Well, it really didn't change. I'm still I'm a nurse anesthetist, so I'm still doing general anesthesia, but certainly in the preoperative area, it definitely has changed I'm kind of semi-retired now, and so I'm not really doing general anesthesia anymore. I'm doing just conscious sedation and so forth. Um, but I'm utilizing it in the pre-op area quite a bit. When I do work in pain management, I'm also working in an angioplasty suite where we have very, very sick patients. And it really supplements what we're doing when we can't really give them anything because we're scared they're going to die on the table, to be quite frank, right? And you could calm them down. You can lower their blood pressure. You can just supplement whatever local they're getting, which sometimes isn't enough, but you can supplement it with hypnosis. The issue that is that you really don't call it hypnosis. Especially when you're in the hospital setting. I work at a surgery center, so it's more privately owned and I have more leeway. And the doctors are actually more open to it. Whereas when you're in the hospital setting, it becomes a question of liability. You call it hypnosis, it's not really accepted. And so you just do it without telling people what you're doing. You're doing guided imagery, you're doing visualizations. It's hard to get it accepted. And even in the areas such as with IBS or pain management, where it is really accepted and there are studies on it, it's still very hard to get recognized as a valid tool. Sometimes it's because I believe that it takes a while to do it. For most, I mean, yes, there are rapid inductions and so forth, but it's not as fast as, okay, let me put it in IV and give the meds and that's that. And let's go on. You know, we got the next case to do. That's what you run into. You have the next case to do. And
Yeah, it's a stressful environment. There's a heavy workload, lots of spinning plates. And I've always thought, particularly doctors and, anyone in a level of authority, particularly in the medical world, naturally have this kind of prestige. Lots of hypnotists talk about this kind of prestige that's already there that can kind of help with hypnotic suggestions. They already have that. They already have that authority. I
yes,
think it was
authority.
yeah, I think it was
Absolutely.
Stanley Milgram back in the 50s did a very, profound study in kind of compliance based on authority. And if someone wearing a white coat said something, the compliance went through the roof. So you've got people with a lot of credibility, a lot of prestige, giving lots of very firm suggestions with complete congruency as well. I mean, there is that downward inflection. It's very authoritative. A lot of hypnosis is happening probably by doctors that don't even realize they're doing hypnosis.
All the time. And it like, stop saying, 93% chance of dying, right? Right there. Or say, this is going to hurt. It just boggles my mind. This is going to hurt. As a matter of fact, I had the other day, I had a little kind of wart thing taken off my ankle. And the dermatologist is coming with she's going to freeze it off with the nitrogen. And so she's going to freeze it off and she's telling me it's going to hurt. And I tell her, don't say that. Just say it might be a little uncomfortable. And then she adds, and you might feel a gentle breeze as it freezes off, right? So she took it. What got me is she knew it, but she wasn't utilizing it. She was telling me how it was going to hurt. It was going to burn and hurt. And then when I corrected her, she knew just what to say, that it was going to be a gentle breeze. It wasn't like I told her to say that, right? And it's just their training. And they model what they see, and all the people before have said this is going to be a bee sting, this is going to hurt, and so that's what they do. And some of the docs will change when pointed out. But it's, again, it does need repetition because they've learned it a certain way. So they need constant reinforcement of this is how you should say it, this is how you should say it. And on top of that, here in the United States, we have, it's called the Joint Commission, where you have to ask a patient 3 times a day, I believe, whatever the rules are, but you have to say on a scale of 1 to 10, what is your pain? So you are reinforcing that pain every time you take their blood pressure, every time you're in the recovery room. I mean, you're saying, what is your pain on 1 to 10? Instead of saying, what is your comfort level, right? And you're just banging your head against the wall, and there's really nothing you can do about it at this point. Those are the rules, and you just play the game a little bit.
Yeah, that's it. And it's the power of words, isn't it? The power of language, because I've never actually done hypnobirthing with any clients, but I know lots of people that really that's the thing that they do. And one of the first things that they learn in hypnobirthing is you don't use the word pain. You use lots of words like sensations, comfort, you notice things, but this idea of pain being, a suggestion, I mean, that's a label, and it sets people up. And I think, that's one example of, albeit in maternity words, where you do have hypnosis alongside kind of nursing and kind of doctors. So, things are moving in a direction, I would say.
I because I was married to a physician, to speak on the other side of the coin, and if they don't tell somebody who has cancer, these are your statistics here, then they could be sued that they didn't tell them the full story. I remember, I'm that old, that when I first went into nursing, I was working in oncology, and people were not told at the time that they had cancer because it was a death sentence. There was not the chemotherapy that they have now. So a lot of people weren't told. Whereas now that you have to tell them, and you have to tell them the statistics, and it's very important how you tell them. I was listening to Dr. Bierman just the other day, and he was talking about how statistics are extrapolated. And I actually just I have a girlfriend who was given a horrible diagnosis for her child with white brain matter. And I emphasized to her, it's just extrapolation, right? It doesn't mean your daughter is going to have that outcome, because she was supposed to die at age 4 and she's 28. So obviously she is not in that group. And so doctors have to be really careful how they tell people what's going to happen. It is a weighing of what do you need to tell them, so that they can get everything in order, or even I'm in a group with on Facebook, a lot of groups on total knees, because I had a total knee done. And I tell people, stop listening to the scary stories. It's their story. It's not going to be your story. And if you happen to have a hiccup, and I use the word hiccup instead of a complication, that you'll be able to handle it, and you'll do it well, and you'll have a good prognosis, and doctors will go, you healed so quickly, even with the little hiccup, you healed very nicely. So it's almost like setting ourselves up for failure versus setting ourselves up for success. Focus
Yeah.
on what you want, not what you don't want.
Yeah,
Right?
it's a fine line, because I think there is a requirement to manage expectations and not hide truths and kind of facts. But equally, there's a lot of power in the point of delivery. And for some people, news could feel like a death sentence, and other people it could feel like, okay, it's a challenge, but there is hope, and it's how that is delivered. And when something bad happens to someone, and that could be something very traumatic, there's a way of framing it where they can be a survivor or a victim, and one tends to be more empowering than the other. And it doesn't change what's happened. It changes everything about the meaning given to what's happened and then what follows. We're both speaking at the Irish Hypnotherapy Conference in April over in Dublin. What's your talk going to be on?
My talk is going to be on using hypnosis in the preoperative area and also supplementing for certain procedures where you can supplement what's going on, let's say in the angioplasty suite and so forth. And then John Scanlon and I had a discussion just the other day, and I'm going to have a pre-conference workshop where it's going to be Medical Hypnosis 101, a crash course, because there's more than just pre-op in the operating room or in the hospital setting. There's also IBS, there's pain management, there's hair pulling, there's all kinds of places to use medical hypnosis, and also in disease prevention, changing lifestyle. I mean, I work in the angioplasty suite, and I can tell you, diabetes and high blood pressure, that's it. It's if we could get a handle on that, it would change everyone's lifestyle, the number of years they have and the quality that they have of life. If people's lifestyle just would change and how they handle their stress, how do they handle the negative things that have happened in their life? Because we all have negative things, some more than others, some more traumatic than others, but that's part of being human. And how you deal with that influences your body. And that's where we can use hypnosis, especially, and how we deal with that. Yeah.
Yeah, and I think a lot of the time, I think generations think about things differently. When I think of my parents' generation, a lot of it is, kind of you've got some kind of an issue, and then you get medical treatment. You're treating the symptoms. You're treating what's happened. Maybe I was fortunate, but I had this kind of way of looking at stuff that if I'm sick, I have to deal with the cause rather than the symptom. What do I need to sleep better? Do I need to drink more water? Do I need to eat more fruit? That element of reverse engineering, saying, well, how did I get to this place, and then change that. But if I have that conversation with my parents, it's like I'm speaking a different language. It's kind of like, no, you're sick, you go to the doctor, they write a prescription, you take it. Like it's a cause and effect, but they're looking at the issue, and then the effect is now you take the medication rather than what led to this. And you're right with diabetes in particular, because let's say, in most Western societies, obesity is an issue. People don't join the dots that if you're overweight for long enough, you get the insulin resistance that can lead to type 2 diabetes, which is very reversible, but only if you believe it is. But if it isn't, then it might have those kind of element of, have certain, let's say, kind of wounds that don't heal. And then it could lead to an amputation. One amputation could lead to another amputation. Suddenly they're in a wheelchair. They can't really exercise. And it's kind of like, that's like the 10th domino that's fallen.
Yeah.
And the time to really deal with it was at domino 1 or 2 when they were slightly overweight. What do you think needs to change for people to prevent the issues before they become the issues?
I am in that age category where it was not in my growing up, this knowledge. And especially in the medical world, it was not in my knowledge, right? I wasn't taught anything like that. As a matter of fact, I remember nursing school being taught that once you were an adult, the brain was formed. That's it, right? And here I am, like, I think I got certified in 2000. So, learning all this new stuff between the mind-body connection that I had not a clue about. I'm telling you, not a clue. Um, and it's really, um, we're lucky that it's being more accepted. Holistic nursing, for example, is being accepted. Integrative medicine is being accepted. But there's still a lot of work to do as far as lifestyle. I mean, but definitely, getting to the root of an an emotional issue. Like I was dealing with I've had quite a few clients lately with a chronic cough of all things, right? And they've gone through all these medical tests and they get, now the hypnotist refers them to me because I do medical hypnosis. And there's usually a root issue that is stopping them from speaking up for themselves. But when I explained to them about the parasympathetic and the sympathetic nervous system, and it closes down on the vessels, and then you have the chronic cough, they go, oh, and that's the authority that you're talking about. And then they accept more of that. Okay, then let's get to that issue of why that's stimulating your sympathetic nervous system, right, to react. And what was the question? I get on my soapbox, right, because I see the connection so strongly between emotional issues and what's going on with anxiety, whatever it is. There's an emotional issue that has to be released. And there are so many techniques that we have to release them. And my feeling is you can't just keep on putting a Band-Aid on it,
No, you
because that's all
can't.
you're doing.
Yeah, and I think particularly the pharmaceutical industry, if we kind of niche down rather than looking at kind of the medical industry like it's just one, kind of thing. The pharmaceutical industry mainly is there looking at symptoms and how do you reduce symptoms, and lots of these things are almost looked at in isolation, but quite often one thing is connected to something else is connected to something else. If someone is got high levels of stress over a long period of time, that's going to mean more cortisol. It's probably going to mean more adrenaline. That's probably going to affect sleep. If they're sleepy all the time, they're probably going to be eating more processed food to give them some form of an energy. And then you've got this kind of whole ripple effect that kind of leads to conditions. Plus, a lot of the time, the medication itself has side effects that then need other medications to mitigate the side effects. And it's kind of like, well, if you rewind it all the way back, it's kind of like there is such a huge payoff from having good mental health, having good physical health, having good sleep, having good diet. And it's one of these things that can almost prevent all the very worst things happening just by
It really
getting
can.
some
It
of
really
the key
can.
things.
I mean, even the things about keeping your weight, never mind diabetes and blood pressure, but even orthopedically speaking, so that you don't need to have, well, my knee problems came from skiing accidents, but still, people, if they could just take 10% of their weight off, their knees will get better just by that. And if they could not put on the 50 pounds, then maybe they won't have to have any knee problems to begin with. We have the ability to really have a better quality of life. One of the gals that I was just working with the chronic cough, and she was on, because of my medical background, I asked her what medication she's on, and she was on a statin that is known for coughing. So I spoke to her son, and the son spoke to the doctor, always speaking to the doctor, never telling someone on my own, right? And so speak to the doctor that maybe this is part of the reason for her cough. And within 2 weeks, her cough was much better. Then I was able to get to the reason for the cough, which kind of started many years ago, and which led to the high blood pressure, right? So it's a cascading problem, right? And all you're doing, medications definitely have their purpose and their place, but so does hypnosis.
It certainly does. And you're going to do some hypnosis for us very shortly. But before we get into that and you explaining what you're going to be doing, if people are curious to learn more about you or to work with you or to take the training and your pre-conference workshop, where can they go for more information?
Okay, well, my website is hypnotherapyforhealth.com. And my phone number here in the US is 510-552-7576. And then my email is Seth-Deborah without the hyphen, just SETHDEBORAH at hypnotherapyforhealth.com. And I will get back in touch with them.
Yeah. Well, if you drop me a message, I'll make sure they're in the show notes as well. So you don't have to remember that if you're listening. Just look in the show notes and you can find Seth's contact details and website and those kind of things. But you're going to do some hypnosis for us right now. So tell us what you're going to be covering, and then I'll put myself on mute and hand it over to you.
So this is just a very simple technique that I use in the pre-op area, combining a little bit of heart math, their technique, and then combining some breathing. And it doesn't take long at all. It doesn't take long at all, and I find it very effective. And it's also something that I teach other nurses, because I'm only one person, right? I can't be in all the pre-op areas. But, in the pre-op area, usually people's blood pressure goes up. I mean, we give them 15, 20 extra points just for nerves. Even if you don't think you're nervous, when I take your blood pressure, it's showing up, right? That's your subconscious mind. You're still nervous. So this is just a technique that I've kind of combined the heart math and what I call the red rose technique, and I've added something called the raspberry, which my daughter laughs with. It's so we'll do it. It's a really quick technique that you can just use, of course, in the preoperative area, but you can use it on your own, just if something's really you need to just slow down and get more centered. When we are all wound up, we're almost like that part of us is a 12-year-old child. It can't make any good decisions when you're all wound up. And so you just need to unmerge with that part of you that is all wound up. So,
Well,
okay.
I'm interested to hear this. So I'm going to enjoy the experience with you. So I'm going to put myself on mute, and it's all over to you.
Okay. And it's very quick. So you're going to just sit in the chair, and you're going to keep your head even, right? And you're just going to look upwards at your eyebrows. And you could look at your eyebrows or a spot in front of you or high up on the wall. And just take some nice slow breathing in and breathing out. Now, what I'd like you to do is focus on your heart doing your breathing instead of your lungs. Your heart is breathing in and out, and your eyes are starting to get heavy. And just go ahead and feel that heaviness in your eyes, allowing yourself to blink. That's right, blinking. And then when you're ready, you could just close your eyes. That's right, just allow your eyes to close. Taking another heart breath, breathing in and breathing out. And allow yourself to just feel your heart expanding within your rib cage. And breathing from your upper part of your chest, where your collarbone is. And now just let go of the breath. Now, what I'd like you to do now is imagine a beautiful red rose in front of you. Just imagine that red rose. See it You can see the petals, the redness, make it lighter red, darker red, and that perfect red rose in front of you. And now what I'd like you to do is imagine smelling, breathing in the beautiful fragrance of that red rose. Hold it for a moment, and now imagine that there is a candle in front of you, and slowly purse your lips and blow out the candle. Breathe in the red rose, see it, breathe it in. Let it go into your senses, and now blow out the candle. Breathe in that rose into your senses. Blow out the candle. That's right. And now just go ahead and take your left or your right hand, whichever is more comfortable for you, and place it on your opposite wrist. And gently squeeze the hand, the wrist, and say in a deep voice, peace, peace. You could say it out loud or to yourself 3 times. Peace. And now, what I'd like you to do is take anything that's bothering you, any fear, anything that's bothering you, and you're going to do what I call the raspberry technique. You're just going to take that fear, that irritation, and on the count of 3, you're just going to blow out a raspberry and send it to the universe and give it away. You don't need it anymore. 1, 2, and 3. And then let yourself giggle. And then open your eyes when you're ready. It's just a quick technique that I use preoperatively. And I find the giggle is really, it changes things. It changes all the transmitters in your body, getting that giggle going.
Absolutely.
Most people giggle.
It's a great pattern interrupt, isn't it? They're not expecting to be blowing a raspberry in just before a bit of surgery and that kind of stuff.
I know.
And also, there's probably a little element of regression there as well, because for most people, the last time they blew a raspberry, they were probably a child, and it kind of brings back those kind of playground kind of memories and those kind of things. I think it's a great.
You're right. Tool. I never thought of it. I remember just being in the car with my daughter, and something was bothering me, and both of us, and we cracked up, and I went, okay. So yes, it brings us back to childhood.
That's it. And there's a theory as well called the law of dominant effect, and an intense emotion will displace a different emotion. And if you're feeling silly or playful, that's going to displace that kind of anxiety. So, it sounds like a silly thing to do. Think of something that's causing a problem, blowing a raspberry, but there's a lot going on there, which I think is probably very helpful. Here we are this side of Christmas. We've got the Irish Hypnotherapy Conference in April in Dublin. Right now, I think up until January, there is an early bird price. So if you're listening to this and you want to listen to Seth's talk on medical hypnosis or the Medical Hypnosis 101, the pre-conference workshop, check out that link in the show notes. I think it's irishhypnotherapyconference.ie. So check that out. There's some early bird prices there, and I'll also be doing a talk at the conference as well. Seth, it's been an absolute pleasure to have you on the podcast today.
Thank you so much for inviting me.
No, it's been an absolute privilege, and I'm looking forward to seeing your talk over in Dublin. And to everyone listening, thanks for listening. And probably the next episode will be me doing some hypnosis rather than a guest hypnotist. So stay in touch and listen to the next show. Seth, thank you very much again.
Take care. Bye.
Thank you for listening to The Hypnotist with Adam Cox. the show that gives you inside access to cutting-edge hypnosis with real clients facing genuine issues. To automatically receive the latest episodes, please subscribe. If you'd like to support the show, please share this episode with just one friend you think it could help. And if this episode helped you, please leave us a 5-star review.